So apart from genetics, how does your family affect your health? A landmark study is underway across the greater Golden Horseshoe to study the long-term effects, and Dr. Divya Joshi from the McMaster Institute for Research on Aging Intergenerational Study joins us with more. And there are so many ways that the generations, grandparents, parents, children, grandchildren, all impact each other's lives, some positively, some negatively, and that's what you're looking for.
Correct, yeah. So we want to examine how different factors, social factors, economic factors, demographic factors, physical health, they how intersect each other to impact health of members across different generations, but also across their life course as they age. And so we want to also examine the impact on healthy aging.
Okay, so, and we saw a lot of this during the pandemic where grandparents really stepped up and were looking after children who were being homeschooled or learning at home. But we're seeing it more and more, and I think too, with more immigration, we're seeing a lot more intergenerational living, but that's not necessarily what you're looking for in this study.
No, so we would like to recruit participants who have an intergenerational household, but also those who don't have children or grandchildren, because we would want to understand experiences of both types of groups.
Okay, and so you have about 2,000 people now in this study, but you're looking for many more, and across the whole area here. So somebody in this study, what would their involvement be?
Right, so a participant who is interested in the study would complete a brief 2-minute screener to see if they're eligible for participating in the study. And if they are eligible, then one of our research team members will reach out to obtain consent and explain the study procedures. But it's basically completing a 50-minute questionnaire that can be completed at your own time online, or you could complete it over the phone with one of our research assistants. And because this is a longitudinal study, we would be following up participants every 2 years for at least 10 years.
For at least 10 years. Okay, that's very cool. And you say that this is the first time that this has been done in this area this long, because we've got now 3 generations and possibly a 4th generation that you can talk to because of life expectancy.
Right, and so I think that is what provides us with this great opportunity to understand how intergenerational interactions impact health and aging across the life course.
So what kind of impacts could there be?
There could be, positive impacts, and we see that more and more now in terms of housing insecurity or food insecurity, housing issues. We see that with inflation. We see more and more younger adults moving into family homes after completing post-secondary education. And so we want to understand how does that negatively or positively impact health of all generations. And it would be health across different dimensions, whether that is your financial health, your ability to retire, if it is the older generation, or it could be your psychosocial and physical health or functioning.
And it could be too that first generation, it could be care for them in home.
Correct, yeah. And so how does that impact just health care delivery in the region, in the province?
I can also imagine too, because the poverty cycle is so much intergenerational as well. So you could look at that.
Yeah, how is poverty transmitted from one generation to another generation, and what impact that has.
Okay, this is fascinating. We're going to have to follow up with you every couple of years and to see how this study is going. So if you are interested, we'll get the board up on screen here, and we'll also have the details on our website. So it is the McMaster Institute for Research on Aging Intergenerational Study, done in part through McMaster University.